now I'm going to explain when and how to do micropauses and what are the basic stretches that you should do, especially when you're sitting down. The reason I'm going to be showing these stretches sitting is it's the most probable way that you're going to do the most stretches. If you need to lie down to do a stretch, you can't really do that work. If you need to stand up, well, you can do that work, so it's a good idea to do certain stretches standing, but you're not going to, people are going to see you doing it. But if you do it at your desk, sitting down, there are still a lot of things that you can do without getting too much attention. So, now, micropauses. For sure, the way your desk is aligned and how you're sitting, it's very important. So the ergonomics of your workspace are really, really important, but that's only half the battle. The other half is making sure you're moving enough and that you're not building up too much tension. So even if you're sitting perfectly straight, everything is well rested, and you're just working in a perfect position, you can't just stay like that. You need to be able to move also. So to move, the first thing is to make sure you're doing certain mobilizations, that you're rocking your pelvis back and forth, and that you're going from side to side, back and forth like that also. You can also do certain little translations and rotations, but you have to be very careful, and you can't go very far when you do those motions to make sure that you're not injuring yourself. So first thing is rocking your pelvis back and forth. So you can do it very subtly. You can just slowly extend and round out your back. So arch and round out your back. So you want to do that 5 to 10 times. Now if you do that too quickly, too far, you might end up pinching certain regions. So that's not what you want. You want it to slowly mobilize. You want every joint to move. So if certain vertebrae aren't moving, and there's too much tension there, you're going to have to do it more slowly. If after 10 times it's still not moving properly, well, that definitely means that you need to stand up, walk, loosen up, use a ball to massage certain regions if it comes to that, to make sure that when you do those mobility exercises, that they feel homogeneous, that everything is moving. If not, it means that you're not moving enough. So before I keep going, I'm just going to make sure that people ask me often how often should I do these micropauses, these stretches. Well, for sure it's important to do them a few times a day. And what I tell most people is start by doing them at least once in the morning, once during lunch, and once in the afternoon. So at least you have you're doing them a few times in the day, making sure that you're not too stiff. If you feel stiff while you're doing them, and well, then you're going to have to do it a bit more often. So if it's really stiff, and after 5-10 times, or stretching a bit, it's just really doesn't get better afterwards, it means that you're going to have to do it every half hour just to make sure that you don't have a terrible day, so you don't end up with back pain or something at the end of the day. But if you do it and you feel comfortable, that means that you can wait a few hours, or wait an hour before you do them again. And ideally, you want to get up at least once an hour, move a bit, and come back. Okay. A trick that I always tell my patients that when I brush my teeth, I always have a ball beside my toothbrush. So when I brush my teeth, I massage my back, my upper back, my lower back, my shoulders, I massage my glutes, and I'm just making sure that I'm ready to move during the day, or I'm ready to sleep in a comfortable position. So if we keep going with those exercises where you're mobilizing and you're rocking your pelvis back and forth, so the first one was to rock it back and forth, and you can be less subtle too. You can go really, really far, and really, really far in extension and open up. But the important thing is that you're mobilizing slowly. You can also do it when you're driving. So if you're in your car and you're holding your steering wheel, well, you can pull. You don't need a steering wheel, but if you're driving, you can pull the steering wheel and extend, and you can push and round out your back. You can do it a few times, and again, not going too far, too fast. You can also move in this plane also. So the point is making sure that you're going back and forth, and that you're mobilizing the sacroiliac joint between the sacrum and the ilium. So you can see in the back here too, between the sacrum and the ilium here. And that you're mobilizing the groin also too. So the point is bringing your right knee back and your left knee forward, bringing your right knee forward and your left knee back, and making sure that it's moving in your hips, it's moving in your sacroiliac. You can actually put your hands on your pelvis and just feel where it's moving. If you can't do that, it's a sign that you don't have enough mobility, and you're eventually going to have back problems, because that needs to move. If it can't move, well, it's just a really bad sign. So those are important. Like I said before, you can do some rotations, you can do some translations, but if you do that right off the bat when you're not warmed up, well then you can definitely get some pinching and some very bad surprises. If we move on to stretches, now easy stretch to do for the lower back and pelvis is to stretch your glutes. So if you cross your leg like that, and you can hold your ankle, or not, you can be really subtle and just bend slightly forward while keeping your back really, really straight. You just slightly bend forward. Well, you're gonna feel it pull on the side of your glute. You can also stretch by pulling it towards your opposite shoulder, even turn your back. So these are obviously stretches you can do lying down, but you're not gonna do them in the middle of the workplace lying on the floor. So you can pull your knee towards your opposite shoulder and stretch the glute in a different kind of way. You can also combine with the earlier stretch, you can also combine, let's do it with the other side. You can also stretch your lower back. So if you stay straight, it's going to stretch your glute. But if you round out, you're going to have to go further for it to stretch your glute. But if you go further, you can also stretch your lower back at the same time. So you can do it with the leg or without the leg. If you do it without the leg or with the leg, you can go in different directions. So you're either going diagonally, you're going to the side, or you're even opening up. You can even lift your arm when you're doing it to stretch different kinds of muscles when you're stretching. So make sure you're just changing the angles, and if it's pinching somewhere, you feel it on the side you're going, that's not normal. If you feel it too much in one spot on the side you're stretching, well then you definitely want to release that tension. You're going to have to stand up, move a bit. You might have to use the ball to release that tension because it might not leave by itself. And if you keep that tension there and you keep going, eventually it will be a problem. Okay, so we want to avoid that as much as we can. You can also combine it with even the glute, the lower back. You can do the shoulder, the neck, everything at the same time. But that definitely not the first thing to do. When you're really used to it, then you can start combining certain stretches, and you're used to knowing what's normal and what's not. So you just don't want to go too far and pinch yourself. The point is not to do it really far or anything like that. The point is just to release a bit of tension. You don't have to hold it for very long. Just 5 to 10 seconds is really all you need. And sometimes you can do it on both sides. If you feel comfortable, you can do it again. But if you do it 30 seconds as far as you can, well then, when you let go, you might have a bad surprise. So I'd rather you do it not too far because you're not necessarily ready to stretch it that much. So that was for the lower back and for the pelvis. If we're looking at stretches of the lower limbs, it's easy to kind of just bring your knee towards you, stretch your glute. You can also stretch your hamstrings by just extending your leg and just bending a bit forward. And also, you can keep working when you're doing a lot of these stretches. You can stand the phone, whatever. It's just easy to do a lot of these stretches. So you just bring your leg out, you stretch the outside. You can go forward and stretch the inside, or you go towards the leg and stretch the outside, or you just change direction. You do it with both legs. So that's for the hamstrings. You did the quadriceps already. It's easy to point your foot, stretch the front of the foot of the leg here. You can bring your toes towards you and stretch your calf muscles too. So just stretch those gastrocs and get them to release a bit. It's a very good stretch to do also. Nothing is also prevents you from just stretching forward and just releasing your lower back too. Just make sure that it's a comfortable stretch. Now a more complicated stretch, and I have a video just for that stretch, so you can go see that later on, is for the psoas muscle. It's the hip flexor muscle. Okay, so it attaches to the pelvis here and to all of the lumbar spine. So if that's too tight, your lower back is definitely not going to want to move properly. It can't. Okay, so you need to release some of that tension. And by doing that, you bring your leg back and you stretch the front. Now you're going to feel it here easily. What you want to do is maybe feel it a bit here. Don't overdo it. Just make sure that you're stretching it a bit once in a while so it doesn't tense up. You can lift your arm when you do it. And you don't want to extend, you want to bring your stomach in. You can even breathe in to feel it a bit here, but don't overdo it. It doesn't matter if you don't feel it, okay? When you get used to it, and you do it standing up and everything, you might get better at it and you feel it a bit more, but that's not the point. The point is to stretch it a bit so that it doesn't tense up, okay? So just make sure that you do both sides and you're not overdoing it. You definitely want to do both sides, okay? So it's important to make sure that it's equal. For the upper part, very good to stretch your shoulders back. You can do it more subtly and just bring them back like that. You can grab your hands and bring them backwards, but when you're grabbing your hands, often your shoulders are a bit of an internal rotation. You also want to open them up once in a while to make sure that you're stretching like that. You can get up and use a wall and stretch the side by putting pressure against the wall here and doing it in different directions. But again, that takes more time and you're going to have to stop working. But if you just go back like that, you can definitely stretch. So you want to make sure that that's comfortable so that when you come back straight, that you're comfortable. If you feel that you need to cross your legs, that you need to line one arm or the body working, it's a very good sign that you should be stretching a bit. And after you stretch, you'll be more comfortable straight. That's why it's so important. If you don't stretch, you're gonna kind of need to be crooked, and that's not a good thing. Okay? Same thing before you go to bed. If you stretch a bit before you go to bed while you're watching TV or whatever, and like I said, while you're brushing your teeth, well, you're definitely going to be able to be more comfortable in a neutral position. If you don't, well then you're going to be less comfortable. For the neck, same thing as the lower back. You want to kind of stretch your shoulder away. You can bring it down. You can put it in your back. You can put it in front. You can hold onto your leg and stretch like that. So the point is to stretch different angles. Now, what the dangerous thing people do is they tend to go backwards and kind of rotate. You don't want to compress the back. If you go backwards, the point is to stretch the front, not to compress the back. So you kind of want to go up in a certain angle, and you come back, and then you choose a different angle. Okay, don't go back and start like turning and crushing things. When you go forward, it's a bit the same thing. It's safer to turn, but I'd rather you just choose a direction and stretch that direction. If it's pinching on the side you're stretching, on the side you're bending towards, or it's pinching or like stretching too much at one spot, it means you need to massage that spot. So you can either massage it a bit. You don't have to press that hard. You can do it for like 5 to 10 seconds, release a bit of tension. And then afterwards it has to feel more comfortable. If it feels more comfortable, perfect. If it doesn't, well then you need to move more and you need to warm it up. You can also apply a bit of pressure and just stretch that region. You don't have to go that far, you have to go to the maximum. The point is just to release a bit of that tension there, so that afterwards when you do stretch, well, it feels more comfortable. So that's for the neck. You just want to change directions like in everything. The important thing is not to go too far, not to overextend, overstretch, and just to do it often enough by changing directions so that everything is moving properly and that the blood is really circulating well, so you don't end up injuring yourself. So there you go. Those are basic stretches and micro pauses and when and how long to do them.